I cannot tell you how thrilled I am to be here today. And now that Kinnary sort of told you a little bit about my background, I have to tell you, wearing this kind of swag is so bizarre to me. Because when you're at FDA, you're not allowed to like pick a side or say where you're from. You're supposed to be decidedly neutral. And so here I am with a button on behalf of the National Organization for Rare Disorders. Like I can say that, and I'm wearing jeans on behalf of Global Jeans. So more on that maybe in a little bit. But to echo what Kinnary said, I have a lot I want to say, but this is not about what I want to say. It's really about making sure we have enough time to hear what they have to say. So all I really want to do right now is kind of set the stage for why we're here today and why today matters. So with that, let me just ask this room a question. How many of you have heard when you hear hoofbeats, think horses, not zebras? Good. Are there folks who have never heard that? Okay, good. Oh, good. Oh, good. An honest person. Do you all know where that comes from? House. Well, let me tell you where that comes from. So the first time I heard when you hear hoofbeats, think horses, not zebras, I was a first-year medical student, and I think it was sort of my first few months in medical school. They put us in small groups, and they're teaching us how to do differential diagnoses. And so our instructor said, listen, when you hear hoofbeats, you have to think horses, not zebras. And we're like, well, what does that mean? And the idea is if a patient comes to you in January with a fever and is sick, you think flu. You don't think dengue fever. So think horses, common, not zebras, rare. So that's where that comes from. And that is why you will see zebras and zebra stripes everywhere you see rare disease communities, rare disease patients, because that is sort of the symbol of the rare. Because a rare community is a community of zebras and not horses.